Hello, good evening, everyone. It's an honor to be a part of this panel with such well-decorated colleagues. Thank you for inviting me. So, my goal here tonight is to bring everything home to everyone here, not just in St Kitts and Nevis, but in, the general Caribbean region. So I work in the emergency department here in St Kitts and Nevis, and we have been extremely fortunate here in St Kitts and Nevis that we haven't had any severe cases of COVID-19. Most of the cases here have recovered well, and cases that have had symptoms, they were mild thus far. So I think we're extremely lucky, and I'm happy for that, because St. Kitts and Nevis, it doesn't have the most robust healthcare system compared to other countries in the world, like the USA, the UK, and Canada. Even when some of my co-panelists were mentioning the medications they used to treat COVID-19 patients, in St. Kitts and Nevis, we wouldn't have access to some of those medications in case of a severe illness, a severe case of COVID-19. So that's why it was extremely important in the beginning to prevent COVID-19 from actually reaching the shores of St. Kitts and Nevis, because we would have definitely been overwhelmed, especially during the earlier times of the pandemic. So what I really want to focus on is the healthcare system here is slowly being slightly overwhelmed. And it's not necessarily directly due to COVID-19, but indirectly due to COVID-19. Because what I'm noticing is individuals, they've been out of work for, let's say, for maybe these 14 months. Some individuals are. Some individuals are earning less money because they're only able to work part-time. So I'm noticing patients are slowly coming into the emergency room with minor issues, but issues that could be basically seen at a private physician. Patients aren't able to fill their regular prescriptions, so they would come into the emergency room seeking for help. And some relief for whatever problem or disease or illness or ailment they may have. So when this happens, you're having patients coming into the emergency room. It overwhelms the healthcare team to the point where we're seeing these added patients, but then the individuals who may need our attention immediately, our attention is now divided. The waiting times can be longer because of this. And also, if individuals are rushing into the emergency room, especially during community spread, then there is also a risk of them picking up COVID-19 there in the emergency room, especially with the long waiting times. Now, I have personally seen diagnosed COVID-19 patients here in St. Kitts in the outpatient and emergency room setting. Thankfully, they weren't severely ill, but they came into the emergency room, and there was a potential that they could be interacting with the public because they wouldn't know that they're positive until they actually get tested. So this is the danger. So like my colleague before me said, we want to prevent individuals from reaching to the hospital in the first place. So that's the goal there. And for instance, the burden of COVID-19 here, if people get sick, they're unable to work. And if people are isolated or quarantined, they're also unable to work. That affects the economy, because if no one's working, then finances and jobs and organizations are going to lose money, and individuals are going to lose money as well. And if individuals lose money, it goes back to my point. They're unable to afford medication, proper drugs, and even food. So I've come across individuals who are actually undernourished in the emergency setting, especially the elderly, where they may not have the ability to go out and get their own food and those type of things. And they need a proper diet and proper hydration, or they can get severely ill. So these are the things that I'm actually seeing. And also the healthcare team, not just myself. So we don't actually we have a limited amount of healthcare workers here in St. Kitts. So we actually just don't work in the emergency department, because I actually do community testing as well outside of the emergency department. So not only am I working in the emergency room for majority of the week, but on my spare time, I'm out doing community testing to basically locate any cases that may have any contacts of a case or anything like that. So the healthcare team is stretched just because of that. And if we are exposing ourselves to more cases here, if the healthcare team gets sick, then who is going to actually take care of the general public here in St. Kitts and Nevis? So then these are other concerns with what's been going on, especially during community spread. So the vaccine kind of gives us an opportunity to actually return to normalcy, especially when we reach the goal of herd immunity. So when we reach the goal of herd immunity, what the vaccine does, it provides us protection against severe illness, hospitalization, and death. So that's what the vaccine can do for us. And if we have enough individuals in the population vaccinated, then we can protect the weaker individuals, or individuals who may not be able to take the vaccine, like the children, for example, like Dr. Martin mentioned. We need to protect the children because they can't take the vaccine, at least the AstraZeneca vaccine that we have here in St. Kitts and Nevis. So we have to, basically do what adults should do and protect our young. So I also wanted to speak about the hesitancy regarding this AstraZeneca vaccine here in St. Kitts and Nevis. Different people have different concerns regarding the vaccine. Many of them can be about blood clots. I know that's a very big concern. Some people are actually worried about future fertility. Some people are worried about even just needles. Some people are simply afraid of needles. Some people take the religious aspect to it. So regarding blood clots, so the AstraZeneca vaccine has had a possible link to blood clots. For instance, in the UK, there's been about 300 cases of blood clots as of last month in total. There's been over 31 million doses given of the AstraZeneca vaccine. So when you do the statistics at the rate at which these individuals are getting blood clots, it's around 13 out of a million there in the UK. Okay, so that's a very, very small number. While COVID-19, like some of my colleagues mentioned previously, it actually leads to blood clots. I looked at the statistic earlier. It says everyone that gets a COVID-19 infection. So 39 out of a million chance that you can get a blood clot from a COVID-19 infection based on the statistics I looked. I'm sure it varies depending on which country or demographic. But as you can see, the rate of blood clots are higher in COVID-19 infection than it is possibly with the chance of you getting a blood clot with the AstraZeneca vaccine. And also the AstraZeneca vaccine prevents the complications that come along with COVID-19, like my colleagues mentioned prior, there's long COVID, damage to the kidneys. You have MISC, multi-system inflammatory syndrome in children. So these are things that the vaccines help to prevent. So it helps to protect your health. And without proper health, there's no way this economy can ever possibly bounce back. It's very hard for the economy to get back to where it used to be, because tourism is a very large factor in St. Kitts and how we make a living here. And it trickles down, so you may not directly work in tourism, but tourism affects nearly every aspect of our economy and our livelihood. So one time I was speaking to an individual, and they work in a tailoring shop, and they said, I don't work in tourism, so why do I have to worry? So I'm like, okay, what about the individuals who are out of work, who work in tourism? How will they afford to get their clothes tailored by you? So you're cutting yourself out from a huge demographic of the population, and that will affect you financially. And if it affects you financially, then that can definitely affect your health, because healthcare is generally, it's an expensive thing. I think it's actually one of the leading causes of bankruptcy in the USA, if I'm not mistaken. And in St. Kitts and Nevis, it's generally cheap compared to other countries in the world. So we're kind of lucky there, but we still don't have that robust access to healthcare that my colleagues in the USA may be able to, have access to. So just to bring home the points, because I think we're a little bit over time, but the vaccine gives us a chance to get back to normalcy. It's been proven safe and effective. All vaccines and all medications have a potential for adverse effects. They all have a potential for adverse effects, and I just want to say the benefit of taking the vaccine definitely outweigh the risk of COVID-19, because like Dr. Martin mentioned earlier, the number of individuals who are in the unvaccinated population, we're looking at hundreds of people possibly dying from COVID-19 or getting severely ill. Those hundreds of people here in St. Kitts is a significant amount of people, because we are a very close-knit community. I can guarantee that at least you would know at least one person here in St. Kitts and Nevis who was affected if COVID-19 actually broke loose here in the country. So my advice is to vaccinate when given the chance, because currently we have a worldwide shortage of vaccines, and in St. Kitts and Nevis, we are lucky enough to have access to this many vaccines. We're not fully there yet, but we're pretty close.